This is our cyberanatomy tutorial on the anterior triangle of the neck and root of the neck. If you'll remember, at the end of our last dissection period, we were about here where we mapped out the posterior triangle and done the muscles in the muscular triangle, the strap muscles. That might be a good place to start if you feel like those are a little rusty. Just review those since they should already be clean. That should be pretty quick work. The next thing you'll need to do is to reflect the sternocleidomastoid, just the lower attachment, and then reflect it out and leave it attached on the mastoid. And don't worry, all of the cervical plexus branches that you found before, they'll stay there. They'll move with the sternocleidomastoid, and then when you lay it back down, the nerves will still be there. But once you have that off, that allows you to see right away the structures of the carotid sheath. So that's an easy place to start. Let's do that. We've got common carotid, medial, and internal jugular lateral. These should be pretty obvious structures. They're pretty big. In between them would be the vagus nerve. You'll probably have to get down in between the two. There's usually a little deeper than it looks here. And then while you're working on these structures, keep an eye out for this thin ansa cervicalis nerve. It's this loop that lies on the surface of the carotid sheath. So it's much thinner by comparison to the vagus. So look and try to be careful with that structure. Looking upwards into the submandibular triangle, you should probably make a good effort to identify the digastric, both posterior belly and anterior belly, as a starting point. Then with the posterior belly of digastric, you should be able to find the thin muscle called stylohyoid, which is running right here. It's that muscle that splits and wraps around the digastric muscle. And then with the anterior belly of digastric, you should be able to see the mylohyoid. If there's any fat or connective tissue on the surface of these muscles, just clean it off and get that looking pretty. Also in this neighborhood, you should see that curving hypoglossal nerve, the one that wraps around the lateral surface of the external jugular or external carotid and its branches. And you might also be able to then see where the ansa cervicalis superior root, where it attaches to the hypoglossal nerve. It's not exactly doing that in this image, but you will see that in your cadaver. The next objective is to work through the branches of the external carotid, and you'll start on the bottom with the superior thyroid artery. This one should be pretty obvious since it's the only one that goes inferior and connects to the thyroid. If you work your way up, you'll probably have to push some tissues out of the way, maybe move the digastric a little bit to find the lingual artery and the facial artery. These are both running anterior off of the external carotid, and the lingual artery will come off first typically, the facial will come off second. Sometimes they come off a common trunk, so you can expect variation there. But if you follow the facial artery, it actually goes clear up onto the face, hence the name. So have a look and see if you can demonstrate that. You'll probably have a very large submandibular gland in this space, and you can remove those gland as necessary to expose the path of the facial artery. Coming off posteriorly from the external carotid is going to be the occipital artery, and that's the only one that we're going to be able to see going posterior, so that should be a pretty quick and easy identification. And you'll also be able to see where the external carotid continues. You won't be able to see its termination, but you'll be able to see that as what looks like a continuing branch. So then let's turn to the root of the neck. We'll do this on the other side just for fun. In your dissection you'll do all of this bilaterally. But in the root of the neck, you'll probably want to start by identifying the subclavians. Those are found in this space, and in between them is the scalenus anterior scalene muscle. The artery is posterior to it and the vein is anterior to it. And now that you're in this space, you'll also be able to see the middle scalene and anterior scalene, and the space between them is this so-called interscalene triangle. This is where the subclavian artery and the brachial plexus runs. So you'll be able to see the beginning of the brachial plexus at the trunk levels clear up in this space. So have a look, see if you can do that. And then on the anterior scalene, if you look on its anterior surface, you are going to find the phrenic nerve, which we found a long time ago, will be running on its anterior surface or on its superficial surface. So you can do a pull test on this if you still have it in the chest and ensure that it is in fact the phrenic nerve. And then lastly in your dissection you're going to turn to the blood vessels of the subclavian artery. The vertebral artery is the first branch and deepest. You really have to push a lot of tissue out of the way to get to it, and it goes superior medial to go through the transverse foramen of the vertebrae. The second branch typically is the internal thoracic, and it goes downward. And then the third branch usually comes off proximal to the anterior scalene. In this model, it actually comes off, proximal to the anterior scalene. In this model, it comes off distal. But you can expect to see some variation in these arteries, so I think that's okay. But this branch is called the thyrocervical trunk, and this typically has 3 branches, sometimes 4, as shown here. But the 3 branches you should find right away are the inferior thyroid artery, which is going to the thyroid, the transverse cervical artery, which is going kind of across the neck to go to the trapezius, and the suprascapular, which is running essentially horizontally because it's making its way over to that suprascapular notch that you dissected a few weeks ago. So that pretty much wraps up this dissection. You're starting in the anterior muscular triangle, working into the submandibular, working out the carotid branches, working out the subclavian branches, and then there's a few odds and ends here and there that you should be able to pick up no problem. All right, good luck.